All right. Welcome everyone back. Welcome to the podcast from Mermaid Vet Hospital. Our host here, my name is Tim Hopson. I'm the practice manager here at the Mermaid Vet Hospital. I also have the medical director and owner here, Dr. Mosites. Please say hello.
Hello.
Right. Now, today's topic, we're going to jump right on into it. What we want to talk about today is going to be risk management. We want to take a moment and talk about why this matters and what the whole scale of it is. And so if you don't mind, I'm coming into your vet clinic. I'm your client, Dr. Mosites. I walk right in the door and I've heard the buzzword risk management. And I'm like, what does this mean? How does this relate to me and my pet?
I've gotten super into the idea of risk management as a sort of all-encompassing strategy of veterinary medicine. So I think it really encapsulates the way that I approach my medicine, at least, and I think the way a lot of veterinarians do as well. So risk management is basically acknowledging the fact that there is no perfect option. There is no perfect answer. We know what would have worked when it works, and we know what's not going to work when it doesn't work. So we can't see the future, unfortunately. And what we do instead is we say, well, at a population level, this has this chance of success. And so I'm going to recommend this. And then we start to work backwards to what is possible. So we talked on the Spectrum of Care episode that the gold standard, which would be the best chance for success, is not necessarily going to be an option in every single case. So we say, what should we do, or what would I recommend doing? And then we start to peel back layers and say, what is an acceptable risk level for this client, for this patient, for this situation?
Oh, I like that. Again, I like that this isn't a one size fits all, right? This is you tailoring it to each specific pet's needs and also their situation they're in.
Exactly.
So when it comes down to the risk management, can you give me an example, one or two scenarios where you would decide on what spectrum you want to go for this risk management? Whether maybe it's a dog got into a dog fight and came right on in. Where would you start with risk management there?
Yeah. So the dog fight, I think, is a great one to start with. It's the one, we're talking, this is based on a blog post that we just posted onto our website, themermaidvet.com. And I think the dog fight is a great example because there's so many unknowns in the situation. And because it is a deceptively simple situation, a deceptively simple injury in a lot of cases. And so the way I describe a dog bite wound, or the way I explain it to clients when they come in, is if you see a puncture wound, so dog comes up, bites another dog, tooth goes through the skin, you see that puncture wound from where the tooth went through the skin, and you maybe see a little enlargement around the edges where that tooth went through the skin, because obviously that dog is going to bite and it's going to shake. And your dog, if your dog's the one getting bitten, isn't going to stand there and happily accept what's happening. So it's going to try to thrash and move away. And so what we see in the end is we see this small circle that is present on the skin, right? That's where the tooth went through. But in reality, if you were to peel back that layer of skin and look underneath the surface, all that thrashing and moving, we've now taken a pendulum and started swinging it around the inside of that dog's body. And so you get sometimes a much larger wound. And when we're just glancing at it in the moment from the outside, there's no way for us to know. So when we're talking about risk management, a dog bite is a great example because you've got an injury of unknown severity in a lot of cases. You've got possibility for risk for infection because that dog's mouth is filled with bacteria and now it's underneath the skin. You've got an environment where bacteria has a great chance to grow because it's warm, it's moist, it's got plenty of nutrients in the form of blood. And your dog's body's going to have a difficult time getting nutrients there because one, inflammation is present. Two, you might have damaged or dead tissue, so it's just not able to heal at that point. It's rotting away, basically. And three, you're going to potentially have compromised blood flow. So if there's a crushing injury, if there's just significant damage to the vessels, the body's not able to get nutrients there. So that is a great example where I know the best possible scenario to treat that wound, but I don't necessarily know in the moment is everything that I can do necessary.
No, I think it's great to have the take from the side of the vet because as a pet owner, I'm at home. My dog was just attacked by another dog. I begin to panic and I'm calling. Of course, I'm calling first. Do I really need to come in? Is it okay? Am I going to heal at home? So some of these, the concepts of actually infection encapsulated in there, that's something new to me, and it may make me more likely to want to bring my pet in so that I can kind of prevent error later, prevent a bigger medical bill down the road, right? Because essentially that's what we're trying to decide. Am I bringing in my pet and paying this upfront cost when it's really not necessary, or is it going to help me in the long run by going in now?
Yeah. So I think it's a great question. And the way I help my clients decide is I basically lay out a menu of scenarios and a menu of options available. So we have a scenario where we have full blown infection, massive tissue damage, lots of bad things happening, and it goes downhill. The wound gets bigger. It starts to abscess. If it's on the leg, potentially up to losing a limb, all these secondary complications. And then you've got the possibility where it heals on its own. And it isn't that deep. The damage isn't that bad. It really is just a puncture in and out. It's very superficial. So I let them know, any of these things can be possible. I try to give them my best estimation on a physical exam of the pet, what I think might be going on in this case. And then I go through the menu of how do we find out and how do we intervene to make sure it's not as likely to happen. So on the far end of that scale, the most expensive side of that is going to be getting them under sedation, exploring that wound, getting them under full anesthesia if we need to, so that we can remove the damaged tissue, sew everything back together, flush it out, get all that bacteria, that debris potentially as well, take it out of that wound, get it sewn up, get them on antibiotics, get them on pain meds, get them going home, get them in an e-collar so they're not licking at it and introducing even more bacteria into it, and go from there. On the very narrow or the very low end of that spectrum is watch really closely and come back if it's not looking the way it needs to. And you've got everything in between, right? So closer to the low end would be flushing out the wound at least, getting it cleaned up superficially, or getting them potentially on just antibiotics, all the way up to some lesser form of that full treatment.
Oh, absolutely. So essentially what you're describing here is whether I, as a pet owner, want to be proactive or reactive to the situation, right?
Proactive or reactive, because I've had situations where we do nothing and it goes perfectly fine. And I've had situations where we do everything that we can and we end up having something like a resistant infection, which is not very common, but is possible. And so it's just not super likely for either one of those to be the case. And so I'm not saying this will happen or this won't happen, because I can't say that. I'm saying, what are the odds and should we be more proactive or reactive? And so I think proactive or reactive, like what do we mean by that, is going to be, are we doing smaller interventions earlier on? Or are we, in a reactive case, coming in, trying to clean up this big, nasty mess that was created because we tried to push things off as much as we could?
So what you're asking me is if I am a gambling man, right? Am I taking that risk?
Yeah. Like, are you putting it all on 00, or are you taking a slightly safer bet and smaller increments?
Okay, well, that's fair. So I'm grasping the concept, right? I come in, handle some of these things proactively, and maybe it kind of helps me down the line. Maybe I prevented a major surgery or some kind of major issue that may have occurred. But is there a point to where maybe we're doing too much, or maybe I don't need to go for the full-on treatment, or maybe it is better for me just to watch and wait?
So I think there's an entire additional podcast or rant that I can get into about interventionism in Western medicine and the potential problems with that, because sometimes doing nothing can be the right answer. But unfortunately, if you do nothing, even if it was the right decision, if it doesn't go the way that it should, then you potentially be held liable for doing nothing. There's always a risk when you do nothing, and there's always risks when you do something. So if I have a dog with a scratch, I don't think it's worthwhile necessarily to get them sedated or under full anesthesia so that I can get that scratch cleaned, because the risks of the scratch are much lower than the risks of anesthesia in that case. If I have something that is likely going to heal on its own without intervention, I'm going to use, if I need to, a topical antibiotic rather than a systemic, because when we're using systemic antibiotics, you can promote resistance. So having animals on too many antibiotics is a problem as well. And then the other thing that we keep in mind is the point of diminishing returns. And so when you have medical intervention, a little bit goes a long way. So analogy I like to go back to is the advent of soap. When we learned to wash our hands between patients, we dramatically decreased the mortality rate in human medicine because we just weren't spreading germs. We can still do that today, and it still has that really added benefit, because if you go into an area where they don't have that knowledge or they're not washing their hands, mortality rate's going to skyrocket. So there's simple, very inexpensive things that we can do to greatly improve our outcomes. And then every little bit of additional safety we get on top of that gets to costing more. So developing a new drug is going to cost a lot more than using an existing one. Developing a new technique or getting to that next level of medicine is going to take that much more energy and effort, because we've already figured out the things that could be figured out so far. So think about it like the Olympics. The difference between first and second place might be 0.1 second. But the difference between getting that 0.1 second faster might be thousands of hours of training. So the difference between first and second place has a disproportionate input to output. So for every level of safety better, it costs a lot more. how does that apply to us in general practice? I promise I'm getting to it. So in the case of sedation, in the case of anesthesia for a routine procedure, I'm not a board certified anesthesiologist. I don't have one on staff. Generally speaking, I'm not going to use one because even though it gets us a little bit safer, in a situation where we're 99.9% safe, where we have, 1 in 10 patients pass under general anesthesia just every day in veterinary medicine, then you look at what additional benefit we could have gotten from having a board certified anesthesiologist on board. It might be only 0.005% better. Is it worth adding the cost of a general boarded anesthesiologist, having them full-time in practice? Most people would say probably not, because the problem is going to be in that scenario that we can't get the procedure done at all, rather than we're not being safe enough in the procedure. Does that make sense?
Yeah, it does. Absolutely. Okay, so we've went over a few different concepts here today about managing risk, deciding when to come in, when not to, when you do come in, what aspect of care and how far until you start getting diminishing returns, right? So let's break it down to what the questions will actually look like coming from your clients, right? So these are some of the common questions that we get from a client, right? They call us, issue like the dog fight or a dog got ran over or some kind of injury happened, right? When is it okay to wait?
Oh, just like in general?
Yeah. So say whether they're deciding whether they want to come in, stay at home, if they should bring the pet right in, if they should, watch it at home. Are there any times when you say it's okay to wait as opposed to coming in?
Yeah, there's plenty of times. One that comes to mind is a dog that has an episode of vomiting. Our cat, especially, that has an episode of vomiting. One episode of vomiting in a cat can be totally normal. It can be within the realm, within normal variation for that pet. And so I'm not going to start doing a litany of tests necessarily, when it could be that they overgroomed themselves. They got a little bit too much hair in there. It could be they found something on the ground, like a little piece of fluff or something, and ate it, and it irritated their stomach. For a dog, the same thing. They could be chewing on something in the backyard, ate a little bit of dirt that caused them some upset. They could have gotten something that just disagreed with them a little bit. So just like you or I'm not going to go to the hospital if I vomited once, especially if I had a heavy night of drinking the night before, because I have a reason for why that happened. Not that I do that.
What if you ate a piece of fuzz off the ground?
I'd be going to a doctor for a different reason, probably, to find out why I'm doing that. But if I'm having multiple episodes of vomiting, if I'm not wanting to eat in between them, if it's going on for a prolonged period of time, that's when I want to get in there. So in the case of vomiting, typically what I look for in my patients is risk of dehydration, because losing water and losing hydration is going to be a threat much quicker than lack of nutrition. So that's usually where that decision factor comes in for me. So that's for vomiting. For diarrhea, in the case of itching, same thing. There's a threshold where we go from scratching to being a noticeable amount, to disrupting quality of life, to creating surface wounds, to creating really nasty wounds that are deep. So there's a level of comfort each client has, or each pet owner has, and there's my level of comfort. In that case, normally I say, if it's disrupting quality of life, come on in, let me take a peek, make sure there's nothing else going on. It could be that you're just very observant, but wouldn't we rather know in this case? If it's, my dog scratches a couple times a day, I never really noticed it before, I can't tell if it's different or if I'm just noticing it, I'll say keep an eye on it, and I'll say, are they sleeping well? Can you distract them when they're scratching, and do they start to pay attention to you, or do they go right back to scratching? What is it on a level of 1 to 10? So there's plenty of times where it can make sense to wait. That being said, there's always a risk with anything. You can have a perfectly normal pet that has something else that's going on, that what we're seeing initially is a very early sign of that. And only in retrospect do we say, that scratching was because of a neurologic disorder that maybe we should have noticed. That, when it's 1 in a million, you're not going to, but there's always a possibility it's something.
Okay. So you're saying that even if I do say I luck out and I can keep my dog at home, if he threw up once and we're not too worried, I need to take him, I can keep him at home, but I'm not off the hook, right? What you're saying is still observe him, make sure everything goes well, that we don't see a repeat pattern. It's not just stay home and everything's well. It's stay home, but observe, right?
Stay at home and observe, and do what you're comfortable with. So it's about accepting a level of risk tolerance that you're comfortable with as a pet owner. If you are made very nervous, if you're really uncomfortable with any signs of illness in your pet, I have no problem bringing them in, doing a full physical exam. If there's diagnostics that make sense, that don't seem like a total waste of funds, I'll recommend them. If there are ones that make sense that potentially could be a total waste of funds, I'll try to communicate that. But realistically, I never know what the answers are going to be. So if you want to find those answers, then it just becomes a value question. And
Okay.
that's not a decision that I feel comfortable making for anyone, because I don't want to discourage someone from doing a diagnostic where we could find something at the same time. I don't want to encourage someone to do a diagnostic where it comes back normal and now we have no money for food that week, right? That makes no sense.
Absolutely. Okay, so we talked about that there are scenarios where you can stay at home, you can wait, watch, observe if you're comfortable there. What about situations that you just shouldn't wait? Like it'd be silly for me to even ask.
So I would go back to, in that case, at the clinic, we have a list of get them in right away or get them to an emergency clinic right away scenarios. So if you've got intractable vomiting, so that means vomiting where it's fasting them is not stopping it. They throw up even after they've got an empty stomach. They can't hold anything down. They can't hold water down. Get into a vet right away. If you've got a situation where you have increased respiratory effort or difficulty breathing, or you're having a difficult time getting that air in and out, or if you're passing out, get into a vet right away. If you've got any kind of dog bite wound that breaks the surface of the skin, and in some cases, even when it doesn't, because there are situations where owners come in for one small scratch and we do a physical exam, we find several more wounds that are more significant that were hidden by fur. That usually I'd say come in. So those would be a couple examples. So I'm sure there's more, but at least that's what comes to mind initially.
That's a nice quick triage for our viewers at home and our listeners at home. Well, thank you for taking the time today, Dr. Mosites, to kind of walk us through these different situations of risk management. I'm trying to decide when we should not come in, realizing that we're not completely eliminating the risk, either by staying home or coming in, that there is always going to be a risk, but we're just trying to mitigate it as much as possible, especially here at Mermaid. Is there any other closing takeaways that you'd like to kind of throw out there for our audience? Just a quick remembrance summary?
I would say be comfortable with your vet. Make sure you ask what the worst case scenario could be if you don't do anything. Just find out what the best case, the worst case scenarios are, and then have a conversation about cost and benefit of each possibility. So if you can get 80% of the way there for half the cost and you're comfortable with that 20% risk you're leaving on the table, then maybe that makes the most sense for you. But just make sure you have that conversation with your vet. Make sure you're comfortable with the decisions that you're making and the possibility for getting a bad outcome regardless of what you do, because that's always a possibility with everything that we do. And then if you do take the approach of doing nothing, remember that does not take the burden off of you for closely monitoring at home and making sure that you are doing so with intention.
Wonderful. Well, thank you everyone for tuning in today. If we were unable to answer your questions, or maybe it's just something different you would like us to cover, feel free to give us a call. Call us at the clinic at 772-925-1625. If you're local to the Vero Beach area, we'd love for you to jump in and say hello, shake our hands, and check out the clinic. Be sure to also check out our social medias. We have Facebook and Instagram. Like and subscribe, as well as following the podcast and downloading them regularly. We will be attempting to update this weekly. That's our goal, right?
3 for 3 so far. This will make 4.
Yes, and find us on YouTube as well. We are going to be dominating the social medias and the, and the internet before you know it. So keep an eye out for the Mermaid logo and the Mermaid name. This is going to be a brand that you can trust, and we'd love to have you in our clinic sometime.